Thanks, Laura, for the detailed introduction of our resource, the pamphlet. What you see in the screen is the knowledge to action cycle. This is a conceptual framework developed to guide health professionals to change their practice. The knowledge to action framework is a dynamic and interactive process which includes a knowledge creation component and an action cycle, which you can see on the screen. It also includes an assessment of the local context and culture when planning the implementation of evidence into practice. During the knowledge creation process, practical guidelines developers synthesize the relevant research and make recommendations for practice that become knowledge tools. Then the knowledge tools such as clinical practice guidelines can be implemented during the action cycle. The action cycle refers to activities required to implement knowledge or evidence into practice. The major action phases are the processes needed to implement knowledge in healthcare settings, namely identification of the problem. Our team focuses on the first 5 components of this framework to create this pamphlet. This resource describes how translation of evidence-based dysphagia management interventions could be achieved in the population of stroke patients. In the first phase of identifying a problem that needs addressing, identifying, reviewing, and selecting knowledge relevant to the problem for translation into practice, our group identified the lack of applicability and the limitation of the effective use of swallowing therapy, and we selected one particular recommendation from the Stroke Rehab Clinical Practice Guideline. The second phase is to adapt or customize that knowledge to the practice context. The pamphlet identifies the importance of developing clinically meaningful and cost-effective dysphagia intervention under speech pathology management. Our resource addresses the issues of guideline implementation and utilization. In this pamphlet, we attempt to promote the evidence-based clinical intervention for dysphagia into action. Swallowing is not as easy as it looks. We clearly outline the intention and skills required to implement the swallowing treatment. The third phase is to assess the determinants of the knowledge use, including barriers and facilitators. We first identify the barriers of research utilization. The big issue is the practice environment. Imagine those policies, practice standards, workload, cultural factors, economic factors, etc. They interfere with the prioritization of the treatment that the patients get. Multidisciplinary teams have different decision-making procedures, and patients can be really busy in a day, scheduled with all kinds of medical checkups. The fourth phase is to select, tailor, and implement the interventions to promote the use of the knowledge. The key element to achieve access to high-quality dysphagia care is a comprehensive dysphagia plan covering the full range of dysphagia control. We recommend a holistic approach involving the multidisciplinary team to deliver dysphagia management interventions. It is achieved through collaboration among researchers, health professionals, patients, and families. That is why we developed the pamphlet to raise awareness and knowledge of speech pathology management, and we target this to the potential knowledge users, including the doctors, nurses, aligned health clinicians, multidisciplinary team, patients, the family, and the public. We also elaborate our care for our patients. We clearly describe various types of strategies, advice, and exercises that we use to assist patients with dysphagia. The fifth phase is monitoring knowledge use, such as changes in knowledge and attitudes. We aim to improve acceptance of recommendations by practitioners so that we could provide the best of available care for the patients. This is the end of our presentation. We hope that you enjoyed the topic of swallowing therapy following a stroke. Thank you for listening.